Melissa Fuller with Shape of the City, and today we are at the Community Health Endowment. I'm with Lori Seibel with the Community Health Endowment, and we are going to be talking about the Place Matters Community Mapping Project. Hi, Lori.
Hello.
All right, so talk a little bit about this mapping project. How did it get started? When did it get started? What was the initiative about?
Well, we started the mapping project back in 2015, and we began crafting maps at that point, and we learned a lot, and so we did them again. We remapped everything in 2017, which again, we could start to see if things were getting better or worse, but 2 points don't make a trend. And so now we did them again in 2019, and we're beginning to be able to see how things are changing geographically in our community.
What are some of the big improvements you are seeing over this span?
Well, life expectancy in Lincoln has improved, 0.3 years, but in a lot of places around the country, life expectancy is decreasing, so we should be really, really happy about that. Another area we've seen a huge change has been in prenatal care, which we're excited about because a lot of people have made huge investments in that. And of course, having babies healthy when they're born is a great way to not only make sure they thrive in our community, but they have longer life expectancies as well.
Are there any challenges that have come up or that you've seen with the data?
There are some challenges. We, for the first time since 2015, put our smoking or tobacco use map back in our map book, primarily because vaping is becoming such a public health crisis, and it's something that we have to keep a close eye on. We know that people who vape are more likely to smoke, and people who smoke are more likely to vape. So we know that relationship is there, and we want to really keep a close eye on that. We've also been able to look, interestingly, at healthcare coverage because the Affordable Care Act was implemented since we did the maps the last time. And this is one of the things that shows how great maps are, is because we're able to go to the parts of the community where we're seeing, even in light of Affordable Care Act, the number of people who are uninsured still continuing to increase. So being able to go and really target those areas is a really great use of maps. One of the things that I think is a specific concern is we were able for the first time to map childhood or youth fitness using data from the PACER test that many people may be aware of that's used in the Lincoln Public Schools. And what we know now are there are areas of our community where 40 to 50% of kids, even higher, cannot pass the PACER test. And so that is of particular concern because that does not bode well for long-term health outcomes for kids, even in not only health, but in terms of things like academic success and long-term viability going forward.
Are there other ways that organizations or even your organization can utilize these maps or are utilizing these maps to move forward and make changes?
Almost every organization has some place-based activities, and even organizations we may not think about, churches, schools, places that are really uniquely planted in neighborhoods. And so being able to look at universities, being able to look at neighborhood associations, being able to say what's happening in your neighborhood that sometimes you can't even see on the surface. There are things that are beginning to percolate in a neighborhood where attacking those problems and those challenges early can really make a difference. So anyone that really has a location focused, something where they really believe they're planted and serving a neighborhood or an area of our community can benefit from these maps.
So for viewers out there, whether they're just individuals or organizations, how can they get access to these maps?
You can go onto our website, www.chelincoln.org, and not only are hard copies of the maps there and you can look at them, but you can also go to our interactive maps where you're able to go down to the very neighborhood, the very block where you live and look at what's happening there. And those are often the most helpful and the most interesting to folks.
And one, I guess we missed too, in terms of how were these created, who are you partnering with?
We are absolute partners with the Lancaster County Health Department and many others. We work with the Urban Development Department, we work with Lincoln Public Schools, we work with the University of Nebraska Extension. And so we are constantly reaching out to folks who have really good data and bringing them all around the table so that we can benefit from each other.
So looking into the future, what are your goals looking in the future in accessing these and utilizing these maps?
We just hope more and more people will utilize them. We believe that you really can love what you know. It's hard to love something you don't know. And if you really understand your community and know it, it's a place that you're going to want to take care of. And so I think it's important for all people to know what their community is like. It's important for them to know what its challenges and its strengths are, and to put their own individual talents and resources into place to make it a better place for all of us.
Well, thank you so much. And again, on it's chelincoln.org to check out the maps. And thank you so much.
You're welcome.
Yep.
It's everybody's responsibility to be fire safe. Improper cigarette disposal is one of the leading causes of fires in homes.
As someone who's been a victim of a cigarette-related fire, I ask you to put out your cigarette safely.
One flick can ruin many lives.
Please, put out your cigarette safely.
Learn how to stop the fire before it starts. Visit tobaccofreelancastercounty.org for information about safe cigarette disposal.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for a Healthy Lincoln wants you and your family to live longer, healthier lives. It's easier than you think. Walk the dog every day, play more, and text a little less. Swap out a sugary soda or energy drink for water once a day. Keep fruits and veggies handy for snacking. These simple changes can add 5 years to your child's life and make your whole family healthier. Learn more at healthylincoln.org.
Hello, I'm Cassandra LeBlanc with Shape of the City. 1 in 4 deaths in America are due to heart disease. Today I'm speaking with Dr. Bob Ronner from Partnership for a Healthy Lincoln to learn how we can better take care of our hearts. So Dr. Ronner, we often hear about heart health. Can you tell me a little bit about that?
Well, basically, heart's kind of important. That's what pumps all the blood, and if it doesn't work, we're done. And so the question is, what keeps your heart healthy? And there's a number of things that kind of go into that. People often know about genetics. They don't realize that actually the biggest things are actually things within our lifestyle. So the things that keep your heart healthy are just, one, sometimes avoiding things like smoking and vaping, for example. Nicotine is probably one of the worst things for our heart health. Although it's actually not the most important now. Actually, they're saying sitting is the new smoking. That actually lack of physical activity, or on the positive side, being more physically fit, is even more predictive of heart disease. And I think some people saw in the headlines a few weeks ago that there's a huge national increase in heart disease, and Lincoln was the fourth worst increase. And so the question is why? And a lot of it boils down to fitness and diet, and unfortunately maybe the rise of vaping. So it seems like a big increase was actually in the younger population. And so maybe our older people above 65, heart disease hasn't gone up a lot, but it's gone up a lot in the 30 to 40 to 50 range.
Yeah. So you told us a little bit about some of those key life choices, but can you go in a little bit more about what are those risk factors?
Well, fitness is, like I say, is the biggest one, and fitness is more than one component. And that kind of confuses people a little bit. Like, is it steps per day, for example? Well, actually, yes. And there's pretty good evidence, depending on your age, anywhere from 7,500 if you're older to, if you're young, maybe in 10, 12, or 15,000. You just need to give that a cumulative amount of exercise. That's also not just for your heart. That keeps your bones healthy, too, and your balance. But it's just not steps alone, it's also intensity of exercise. So you need to get your heart rate up pretty fast, because that's what builds up the reserve. There's even some studies showing that if you adjust for the aerobic fitness on a treadmill, sometimes your weight actually doesn't matter, meaning you can be overweight, but as long as you can get to this higher level of physical activity, and they use a term called 10 METs, that if you can get to that, actually that gets rid of most of the negative consequences of your weight, but that needs some intensity. And the reason that helps is if your heart can do 10 times what you can do at rest, if something bad happens like a heart attack and you lose half of your heart's ability to pump, but you still have 5 times left over, that's what allows you to survive a heart attack. Or if you fall and hurt yourself and have a broken bone, or you make it through surgery, survive a car wreck, you need that extra heart reserve to be healthy. The other thing is something has to do with what may clog up your arteries, so like cholesterol and things like that. Partly that's duration of exercise. So you also need to exercise a certain amount of time, 20 to 30 minutes at a pop. And the reason being is your muscles store enough energy so they don't really change your metabolism until you start exercising more than 20 to 30 minutes. So intermittent 5 minutes doesn't always get there. You need some duration as well. So it's kind of a combination of getting enough steps per day and not sitting too much. It's getting your heart up to a high rate so you have some reserve, and then enough duration so you change your metabolism a little bit. And so all of those things kind of go into the physical activity side.
Yeah. And that's a lot of information. Thank you for
Yeah.
that. So that definitely leads me to believe that those are ways that we can reduce our risk of heart disease. You mentioned about the Wall Street Journal, and I did see that article, and I saw that I want to say the ages was between 45 and 64. Do you have any specific advice maybe for someone in that age group about what they could do? I know you mentioned physical activity, but maybe one more thing.
Another thing is diet. We're getting way too much sugar in our diet. And so actually cholesterol was a little overblown in the past, and partly that was a diversionary tactic from the sugar industry. There were even some lawsuits potentially about that, where some studies were done and not categorized correctly because of payment by the sugar industry. And so it turns out that sugar is bad for your heart, and maybe even artificial sweeteners too. And so it's also what you eat. Fruits and vegetables are very much important. It's kind of a displacement. If you're not eating sugars, hopefully you're eating fruits and vegetables and nuts and things like that. And so your diet can make a big difference. Blood pressure makes a big difference. You have high blood pressure, getting your blood pressure controlled. And then diabetes is a big risk, which also ties back to bad diet, too much sugar, not enough exercise. And genetics does make a difference. Maybe 20 to 30% of the difference is genetics, but really lifestyle is the big one. And then again, you can't forget about smoking. We made huge gains in smoking in the last few decades. Unfortunately, some of that's been reversed by vaping. And vaping doesn't have that cancer risk, which people think they always associate that with smoking, but actually most smokers don't die from cancer, they die from heart disease. And all of that is there, and maybe even more so in vaping. And one of the explanations of why vaping might actually even be worse from your heart is that cigarettes kind of slow down how fast you can take the nicotine, whereas vaping doesn't control that dose. It's kind of like you can get drunker on vodka than beer sometimes, and it may have that similar effect. So we have to think about vaping, and unfortunately that kind of came under the radar, and the vaping rates, especially the younger, are really worrisome.
Yeah, vaping definitely took over fairly quickly, and it's definitely affected our youth. So thank you for bringing that up. So I just have one more question. You know, what if we have a viewer out there that really wants to know what they can do to learn more about their heart health, or if they want to learn where to get any information? Do you have any recommendations for that?
Yeah, I mean, a couple things to do. One is a lot of employers have employee wellness screenings, for example, and they calculate some of these same things. They'll actually sometimes have a health risk assessment. Are you exercising, for example? Do you smoke? They'll check your blood pressure. They'll check your cholesterol. But then, okay, you have these abnormal results. If you have them, what are you going to do about it? And so the ideal ones is you take that into your primary care doctor and say, okay, what are these risks? What is important for me? What should I prioritize? And then sometimes with behavior change, don't go too much at once. So like if you're someone who averages 3,000 or 4,000 steps a day, you're not going to get straight to 10. So you can monitor that just slowly and say, well, I'm 4,000 now, maybe next week I'll try to get to 5. After that, I'll get to 6. And so a step counter can work. Some smartphones actually have an app, and if you look at it, you'll find that actually it has been tracking if you're wearing it, and so that can give you a way to monitor. And so I think those things, because it gives you immediate feedback, and I can look at that and say, well, you know what, I was getting 10,000 steps this week, but now I'm getting 8. Maybe I should, figure out what did I do different. And it's a little hard in January and February. If it's icy out there, you might not exercise. So, if you can't afford it, you go to a mall, for example, like South Point, or maybe it's not outside, but some of the other malls that are indoor.
Gateway.
Gateway. A fitness center might work. Some community centers have walking paths, for example. Even schools sometimes after hours may have something. So there's a lot of options if you can't, but trying to figure out how do I get out when it's cold outside like this.
Yeah. Okay, well, Dr. Honor, thank you so much for all this information today and taking the time to speak with us at Shape of the City.
All right, you're welcome.
Hi, I'm Sophia with the Tobacco Prevention Team at the Lincoln and Lancaster County Health Department. You may already know that effective January 1st of this year, electronic cigarette use became prohibited in indoor work environments and public places in Lincoln. But what does that actually mean? Basically, everywhere you're already enjoying smoke-free air, like restaurants, bars, at work, or other public places, the use of electronic cigarettes and vaping devices is now not allowed. This ensures cleaner, safer air for everyone, because the cloud that you often see coming from those devices is not harmless water vapor, but rather it's an aerosol that contains toxins and other harmful particles. This is an exciting step in protecting and promoting the public's health, and it may be a great opportunity to consider quitting or reducing your tobacco use. But let's remember that nicotine, found in most electronic cigarettes, is an addictive chemical. Therefore, it may be challenging to quit. The Nebraska Tobacco Quit Line is a great resource to assist in your quitting efforts for any tobacco product, including e-cigarettes. Anyone 16 years or older in Nebraska is eligible to call the Quit Line at 1-800-QUIT-NOW to get started. We're also here to help businesses by providing window clings that are free here available at the health department. But why stop there? You can protect your employees and visitors even more by adopting or revising a tobacco-free campus policy. An inclusive policy restricts tobacco use across the entire property, including entrances, parking lots, and vehicles, and more. This kind of policy shows that you are committed to the health and safety of your employees and visitors. If you would like help with the tobacco-free campus policy, you'd like a window cling, or more information about smoke-free housing, or even other questions, please visit cleansafairlnk.org or call 402-441-4108. We're happy to help.
Valentine's Day is like a box of chocolates. You really never know what you're going to get, and sometimes the last thing you want is a box of chocolates, especially if you're really trying to work on your health. We've got some other solutions that you can really use that can be a little healthier and maybe incorporate a little chocolate, but yet keep it healthy. I love to do chocolate dipped strawberries this time of year. All I do is I take about a cup of chocolate chips. If you can use dark chocolate, especially around the 60% cacao or the darker semi-sweet chocolate, that can work great. I use a cup of that with just about a half a teaspoon of oil. I put this in the microwave for about a minute to 30 seconds at a time, stirring until it becomes liquid like this. Then you basically just take a strawberry that you've washed and you really dried thoroughly, dip it into the chocolate, and then put it out so that it has a chance to firm up. One trick that I use is I dunk my fruit through a little bit of ginger ale or diet ginger ale because the citric acid helps to keep that fruit from browning. Then I make sure and dry off that fruit real well before I put it into the chocolate so that the chocolate doesn't seize and get hard on me. Think about all the different fun things that you can dip in chocolate. You can really have a lot of your favorites and have it work out. Maybe I've gone too far. Happy Valentine's Day.
Hello, this is Melissa Fuller with Shape of the City. I am at Sage Nutrition. I am with Emily Estes. Hi. And we are going to be talking about eating disorders. Emily, can you tell us what are the main types of eating disorders that people should be aware of?
Yeah, absolutely. So you're probably more familiar with anorexia, bulimia are kind of common, but actually the most prevalent eating disorder is binge eating disorder. And then kind of more more prevalent right now is ARFID, which is avoidant restrictive food intake disorder, as well as orthorexia. Isn't a specific diagnosis at this point in time, but really a focus on trying to be healthy, and it's something that we're seeing a lot more often within clients.
Can you talk about those other disorders that we don't know as much about?
Yeah, so ARFID is something we see a lot more like in kiddos. We see it a lot in the population of individuals who struggle with like Asperger's or autism, and so it's more of a fear of like texture or maybe specific flavors of food, and so it's more of a sensory issue with the food, so it's not necessarily a body image component. Same with orthorexia, like there's not really a body image component to that, but it's more of this hyper focus on wanting to eat healthy. So we might start eliminating a lot more foods in this quest to eat really specific, what we would typically deem as healthy foods. So where it becomes so restrictive that it starts to impact health and well-being.
All right.
Yeah.
Are there certain people that are more prone to eating disorders than others?
Yeah, so maybe two populations that I would highlight would be adolescents who are going through puberty, bodies are changing, that can be uncomfortable and scary and just unknown of what that's like, and just with our culture kind of focus on body image. So, and then women in that kind of premenopausal time also, where again, like the body is beginning to shift and change, and that might be uncomfortable. So those would be two populations kind of focus on of maybe high risk for those disordered eating or eating disorders.
And you've said to me in the past, it doesn't discriminate. So eating disorders can really affect anyone,
Absolutely,
right?
yeah.
Any age, any type, any background,
yeah.
right?
So we have kiddos, as young as 7, 8 years old, work with elderly individuals as well, so up to, people in their 80s, 90s. So it really can impact any age, gender, sexuality, anything like that. It doesn't discriminate.
What are the big risks that are tied to certain eating disorders?
Yeah, so Certainly anytime somebody has a genetic predisposition, so if eating disorders run in that family, that can be a high risk factor. Culture plays a role into that. Anytime we're going through big life changes, we might be turning to food or body image. When people feel kind of out of control or like they don't have control in something in their life, sometimes we feel like the only thing we can control is the food that we're putting in our body or like the size of our body. So those can be some risk factors that might lead somebody to engage in eating disorder behaviors, just trying to control and manage their own body and feel like they have control of something.
In terms of just how an eating disorder can affect people as well, like physically, emotionally, what should people be aware of?
Yeah, so I think you highlighted well, physically, emotionally, mentally, all of those are going to kind of play a role. So we often see eating disorders alongside of depression, anxiety, OCD, PTSD. So it's really, encompasses a lot of that mental health. But physical sometimes, we don't want to look at somebody's size of their body, or like we can't look at the outside of somebody and see what's going on. So they could be experiencing, low blood sugar. They could be having heart issues, losing hair, just low energy. There could be a lot of things head to toe that's being impacted because of the lack of nutrients going into their body. And so we really want to be paying attention to that. But also with their mental health and that kind of depression, anxiety, it's kind of a vicious cycle that all of those things feed into each other.
If there's a loved one out there that may be concerned, or what are the things they should be looking for someone maybe that was close to them?
Yeah, absolutely. So things that we might notice in individuals who are struggling, maybe they begin to isolate themselves, starting to avoid places where we would be eating with other people, start to restrict certain foods or eliminate food groups, maybe just higher anxiety. Sometimes in kiddos we see maybe at the table they're becoming a little bit more anxious, or explosive is a term I've heard recently with patients of it's just really tense and stressful to be in that environment. So whenever we're seeing more higher stress around food or body image concerns, that can be a red flag. If people are going to the bathroom right after meals, might be purging their meals, or having obsessive exercise tendencies, those are all things that could be red flags that they're having a struggle with food.
So again, if a loved one now is concerned and they're ready for that next step, getting help, or if there's a viewer out there that may need help, what's that next step for them?
I definitely recommend working with a provider who's experienced in this. So we have the Nebraska Eating Disorder Network, where you can find providers across the state who are well educated in this field and can help in that regard. So, and making sure that we have a cohesive treatment team. So you want to have a therapist, a doctor, if a psychiatrist or medication provider is necessary, along with your registered dietitian, so that you can have all aspects of that eating disorder being addressed collectively, and making sure you're kind of treating the holistic issue there.
And anything else for the general public too? Are there any big misconceptions that go along with eating disorders that maybe the public can help?
Yeah, absolutely. I think right now, just in our culture, we're seeing the shift of, wanting to be healthy, and that's a great concept, and we want people to be healthy, but we're seeing that taken to such an extreme. And so I think of not being afraid of food, we want to kind of fix those myths of kind of speaking into, we don't need to be afraid of food, but really trying to build a healthy relationship with food. So I always tell clients food is meant to nourish our body, not nurture us. So whenever we're seeing that we're going to food for that nurture, comfort, kind of in a habitual sense, we might want to start looking at that relationship that we have with food and maybe seeking out some help. So it's always better to get help before it becomes a bigger issue when you have that opportunity.
And I know, there have been problems in the past too where people may not take eating disorders serious enough as well. Or is that still an issue, do you think?
Definitely. I think one of the common things we hear is I'm not sick enough to get help. So sometimes people feel like if I'm not in an emaciated body, then I don't deserve help, or I don't need help, because my body may not demonstrate outwardly that something is wrong. And so that's a huge misconception, is that there can be so much going going on inside. Eating disorders have one of the highest mortality rates among psychiatric illnesses. And so, I mean, that's one of the things is when we start messing with our food and electrolyte intake, like our heart can stop on a dime. So understanding that the risk, sometimes like you might not have a lot of lead time into understanding what that risk is. So knowing that your body can only fight off the behaviors for so long with an eating disorder, but they can be really deadly. So recognizing that there is potential, really severe potential consequences for engaging in behaviors with eating disorders.
And you do also work with people in terms of their body image. Can you touch on that just a little bit?
Yeah, so I think that can be one of the precursors to eating disorder. So when we start looking at a disordered relationship with food and body, it's a great time to get help. So I love working with people, again, kind of that precursor. We want to be on a prevention side of things. So in recognizing if I'm really struggling with my body image, my body's changing, you know, at different stages of life, of working through like what are those perceived body images that we have, what are our ideal body images, and understanding how that impacts how we see ourselves. I think we put so much focus on our outward appearance that we miss out on the opportunity to really explore what's happening on the inside, mentally, physically, emotionally.
Wonderful.
Yeah.
Are there any other last message you'd like to leave with our viewers, whether they're dealing with an eating disorder or a loved one, or maybe someone who may not have enough information out there?
Absolutely. I always tell people also, like, nothing is insignificant in this journey. So you know, if something happened as a child that still impacts you, your relationship with food and body, that's relevant, and you don't need to wait to get help. There's a lot of benefit in addressing the issue more immediately, and it can impact, this can also be a generational struggle. So if you have kids, or you have nieces, nephews, we have the opportunity to really change that generational tide in how we perceive food and body. So we want there to be a healthy focus in our conversation and focus around food and body, and the sooner that we start to make those changes, the better for not just us, but also the people around us that we love and care for.
So there is also Eating Disorder Awareness Week
Yes.
In February.
Yep.
Where can people go to learn about maybe things going on in Nebraska, events going on in Nebraska?
Absolutely. So they're welcome to check out our social media. Also, the Nebraska Eating Disorder Network has Facebook page, so we'll be posting a lot on there also about the events that'll be happening, Omaha, Lincoln, UNL campus. So we'll be sharing those throughout the month too, to give people a heads up.
Well, thank you so much.
Yeah, absolutely.
Shape of the City is dedicated to keeping Lincoln informed of health and wellness programs and events. Visit our calendar at lincoln.ne.gov, keyword Wellness Calendar. If you'd like to see your program or event covered, email us at LNKTV Health at lincoln.ne.gov.